Hello, colleagues. My name is Aceves Capri, and I am the technical officer responsible for the WHO model list of essential in vitro diagnostics at WHO headquarters. Today, I will talk about some updates on the EDL, but before going to my presentation, I would like to express my gratitude to the organizing committee for the opportunity to share with all of you on the work we are doing on essential in vitro diagnostics. And I will also talk about how IFCC can support us and how your work can have an impact on population access for in vitro diagnostics, but also for high quality laboratory services, especially in low and middle income countries through the WHO IFCC collaboration plan. Um, the primary purpose of any WHO model list is to provide national authorities with a blueprint to adapt for the development and update of their own national lists. You may be aware that there are several model lists uh, prepared by WHO. Of course, there is the WHO EDL, but there is also the essential medicine lists, the priority assisted technology list, and the priority medical devices list. All of these, they intend to help countries in prepare their own national list according to their own context. So countries will review the model lists and then will be able to select those products that are indeed relevant and appropriate for their own context. But what we mean by essential? There is indeed an essentiality concept, and this applies for all health products, not only medicines, not only in vitro diagnostics. And by essential, we mean a limited range of carefully selected health products that, that lead to better health care, better product management, and of course, very important, lower costs. Um, the essential the WHO essential lists are indeed accepted as a powerful means to promote health equity and achieve universal health coverage. And well, this essentiality concept also incorporates the need to regularly update health product selection to reflect new technology options and changing needs. So this is the definition for essential in vitro diagnostics. It is inspired in the essential medicine list definition. So essential IVDs are those that satisfy the priority healthcare needs of the population. They are selected considering disease prevalence and public health relevance. They are based on evidence and evidence, especially for efficacy and accuracy, and of course also evidence of comparative uh, cost effectiveness. Um, essential IVDs should always be available within functional health systems in adequate amounts and in the appropriate assay format, with assured quality and at affordable prices for individuals and for the community. A little bit about the evolution of the EDL. The EDL indeed was born after the expert committee on essential medicines recommended WHO to develop a list of essential IVDs as a complement to the essential medicine list. And this happened in 2017. Then the next year, 2018, the first WHO EDL was published, and it listed 113 IVD categories, mainly for infectious diseases. In 2019, the second EDL was published with 122 IBD test categories. And um, there was a new section for IBDs, essential IBDs for blood screening labs, meaning um, blood banks. And it also included uh, non-infectious diseases. For example, cancer, IBDs for cancer, IBDs for anemia, and neglected tropical diseases. So these were the new sections for the EDL2. EDL 3 was published in 2021. As you can see, there was a change. The first two EDLs, they were released with 1 year of difference. Uh, After second EDL, it was decided that the EDL was going to be reviewed and updated every 2 years. For EDL 3, we listed 145 IBD categories, and a new section was also included. Uh, it is called the Do Not Do recommendation section. So basically here we are including some tests that are um, we are recommended against their use. Of course, COVID-19 section was also part of EDL3 and also tests for endocrine disorders. In 2024, WHO published EDL4, and this time 156 IBDs were included, and the new section was on cardiovascular health and, of course, HEB, HEB virus, um, and well, glucose meters for self-monitoring of glucose levels was also included in EDL4. Before advancing my presentation, I just would like to clarify what I mean by IBD categories. As you know, IBD tests can be available in different assay formats. For example, uh, let's take uh, antibodies, anti-HIV 1 and 2 as an example. We can have these tests, we can run these tests as a lab-based immunoassay, but we also have the RDT format, the rapid diagnostic test. So by IBD category, we are talking about the antibodies for HIV 1 and 2, and then the assay format will be lab-based immunoassay or RDT. I mean, this is just one example. So the last published EDL is indeed EDL4 and well includes general tests for disease, general tests, for example, as tests for hemoglobin, tests for um, electrolytes and plateaus, etc. And also we have tests that are disease specific, and it's covering both non-communicable diseases, for example, diabetes, several types of cancers, cardiovascular health, and a very important component of the EDL, the infectious diseases. Most of the tests are recommended for medical care. However, we also have some tests for surveillance and recommended for use in public health laboratories. Also very important to highlight, EDL does not list commercial products. We are not, let's say, a list of branded products. Only the IVD categories and the applicable assay format and some other recommendations very, very relevant as test purpose, the specimen type, and well, I will cover that in later slides, I guess. Here in the table you are seeing, I just wanted to show you that the general tests are organized by discipline. We have tests for anatomical pathology, for immunohematology, clinical chemistry, clinical microbiology, and well, some we would say serology tests, uh, but well, as far as the EDL4, Yeah, we are calling them like, for example, pregnancy tests, but I will talk about the changes in further slides. You can see the scope of disease in the light blue column. In November 2024, the the SAGE-IVD group, this is the strategic advisory group of experts on in vitro diagnostics, meet here at Geneva to review 18 applications that we received to update the EDL4. And then from these 18 applications, 11 were for additions of new IVD categories, 5 for additions of new assay formats, and 2 for or changes for tests already listed in the EDL. Everybody can indeed apply or submit, sorry, everybody can submit applications for the EDL. So everybody has a role. We would expect IFCC in the future to submit applications for the EDL. But what I want to share here is the composition of the applications for the EDL4. So 8 applications came from NGOs, 6 from academia, 2 from IVD manufacturers, and 1 from WHO teams or departments, and 1 from a non-state actor, such as you. Important also to highlight when we have applications from IVD manufacturers, they need to prepare as every other applicant their application as generic. So they cannot submit an application just for their own branded product. They need to make the application generic as any other applicant. But what is new for the EDL5? And we will be publishing the EDL5 this year. After a recommendation from the expert committee on essential medicines, well, we will be including a therapeutic drug monitoring test for methotrexate, phenytoin, and lithium. Other tests, 13 tests will be added to the EDL. I cannot elaborate more about this because we have not published the EDL5, but just as general comments, we will be including several tests for monoclonal gammopathies, tests for Clostridioides difficile, for lead, Bordetella pertussis, testosterone, hepatitis delta, and a new test format for cholesterol and for creatinine that are already in the EDL. We are working with our colleagues in the AMR division to provide additional granularity for tests for clinical microbiology. What happened is in the EDL4, we already have relevant tests for microbiology. For example, we have culture, we have staining procedures, but what we are hearing from countries is that they need more details. So we will indeed update the test names and the recommendations to provide more detail, more granularity to these tests for bacterial and for fungal infections. We will be separating the test by for bacterial and fungal infections. And well, we will be also supporting effective use of antibiotics and antifungals. So far, we have 3 companion diagnostics for cancer in the EDL, and this is aligned with the EML. I'm sharing this because I would like to invite you to help us to review the companion diagnostics for cancer, and feel free to submit an application if you actually detect a gap between what we have listed in the EDL4 and what you think is relevant in the topic of cancer and companion diagnostics. of course, me on behalf of the EDL Secretariat and the SHIVD members, I would like to invite you to review the EDL4 and the EDL5 when it is available. I will be sharing with, with IFCC and help us to identify gaps or missing IVDs. Uh, uh, we need these inputs from you based on evidence and with a target in mind of low and middle income countries. So I invite you to review the EDL 4 and 5 when it is available and help us to detect this gap, and feel free to submit an application when the call for application is open. There will be also some updates to several disease-specific sessions to align with latest WHO guidelines. Um, Now I can think about the recently published guidelines on meningitis. It has a dedicated section of diagnostics, so we will align with this guideline. And there were also some updates to the TB guidelines for the volume on diagnostics, and also for uh, for TSI, what is the name in English? Sexual, sorry, STIs, sexual transmission infections. We are reviewing, along with this HIVD, these guidelines, and we will be aligning our tests with these updates. If we detect a missing test and it is in the guideline, we will include. Um, the electronic version of the EDL, this is what we call the EDL. We will include codes from the European Medical Device Nomenclature and also codes from the Global Medical Device Nomenclature. Uh, as, as per today, there is already an Excel file in the electronic EDL that you can download with codes and terms for the GMDN system. But we are working now to make these codes embedded in the electronic EDL, and we will be adding the codes for the EMDN. Um, well, uh, we also expect to have these updates in the electronic EDL after July this year. Um, and well, it is foreseen, it is not sure, but it's a plan we have that in the future the scope of the EDL will be expanded to other diagnostic tools, for example, electrodiagnostics and imaging diagnostics. As of EDL5, it is only in vitro diagnostics. This slide is just to demonstrate you about the integration of the electronic EDL with other WHO web-based applications. For example, Medebis is the electronic version of the WHO Priority Medical Devices list. So what we are doing now, and is already available, if you go and check either Medebis or electronic EDL, you will see that some tests in the electronic EDL are already linked through Medebis. So in the electronic EDL, we have the tests, and in Medebis, we have the instrument. For example, the HIV antibodies. If we are talking about a laboratory-based HIV test, then you click there and it will take you in Medebis to the analyzer. So what is in Medebis is actually relevant when countries are selecting and procuring instruments. What is in the EDL, both the printed version and the electronic EDL, is relevant when countries are working on policies to increase access to in vitro diagnostics. So these two lists complement each other. EDL has the IVD categories and assay format and the recommendations on the test purpose, and Medebis will have the instruments. And all this integration is actually based on the resolution on strengthening diagnostic capacity. So if you click on the hyperlink, you will be able to go also to the resolution. I will be sharing the slides with you, by the way, so you will be able to access all of these tools just by clicking on the hyperlinks. And well, what is the impact of this work? The first EDL published in May 2028. Well, it took a little time for countries to to you know to actually start working on their own national EDLs. And we acknowledge that countries already have several lists or several menus. What we are trying to do is provide guidance on scientific evidence. So I didn't have time to talk about the process to include this test in the EDL, but be assured that it's based on evidence, either guidelines, peer-reviewed publications, and this group, the CHIVD, is reviewing this evidence and then making recommendations for tests to be included in the EDL. Coming back to the uptake, by December 2021, two countries had already published their own national EDL. These countries were India and Nigeria. And India indeed also included imaging diagnostics in their national EDL. Then by December 2024, 7 countries had published their national EDLs, and two other countries, and I mean, 2 countries of these 7 countries are working in implementation. So it's not only about these countries. I mean, as I already mentioned, India and Nigeria currently working on implementation. Nepal and Ethiopia have already finalized and published their national EDL. Pakistan, Timor-Leste are just in the final development phase. Honduras in the Americas is the first country that started their work on national EDL based on the EDL. Again, we acknowledge that there are countries that have uh, really good lists already. And well, under development, we have other countries such as Kenya, Malawi, South Africa, Zimbabwe, Vietnam, and Indonesia. The Gambia, I was informed that they already finalized. And then Burkina Faso, Madagascar, South Sudan have also already finalized the national EDL development, and we will be working with them through regional offices and country offices to implement their national EDLs. And with this, I finalize. I said before that everybody has a role on this, and what is IFCC role? As per WHO IFCC collaboration plan for the period 2025-2027, we are counting with we're counting on you to help us disseminate WHO products, either the EDL, either guidelines, other documents that are relevant for lab medicine. We are counting with you to help us disseminate these materials, either uh, either electronic databases such as electronic EDL and Medebis, or any PDF-based guidance. Please help us to disseminate. We need you to share these documents. We also hope to have your support on WHO activities for capacity building and training, of course, through the provision of technical inputs. And these inputs, ideally, they need to be based on evidence. What we are expecting from you is that you prepare these technical inputs and then share with WHO for review and consideration, and then we can share with countries. Important to highlight that the communication with countries can only be made through WHO. We communicate with regional offices, they communicate with country offices, and then WHO country offices is responsible to communicate with ministries of health. We are also expecting, as per the collaboration plan, uh, a report describing experiences, challenges, and opportunities identified in low and middle income countries towards improving the quality of clinical lab services with a focus in quality assurance and newborn screening. And we are also expecting by 2027, of course, a report describing best practices identified on the establishment of newborn screening programs with a focus again in low and middle income countries. And with this, I thank you and I will be available for questions through email. You can contact me here. And I would like to take this opportunity to thank again IFCC for its continual collaboration. And I wish you very successful deliberations. Thank you very much.